So, good afternoon, everybody. And I welcome all for this MS Focus series. And this is a sort of very unusual and unique program where we are dealing with diet in MS. See, because it will be of lot of interest to MS patients that they will be always concerned about what diet to take. And for clarifying all these issues, we have eminent panelists, eminent like lecturer today, Dr. Parthvi Rawat. She is MBBS and afterwards she has specialized in MD medicine. Subsequently, she has done DM neurology from PD Hinduja National Hospital, and she is currently clinical and research fellow of MS and Neuroimmunology Center for Neuroscience Innovation, Flinders University at Adelaide, Australia. So, with this,
Sandeep, loudly.
I'm not going to waste any more time. And now I request Dr. Parthvi to proceed further with her lecture. Thank you.
Thank you so much, sir, for the kind introduction. Just give me a moment to start my slideshow. Yeah. So, when Mrs. Chitnis spoke to me about this series for patients, it was very, very exciting because it was only dedicated to the patients, and she was very kind to let me choose the topic. And I chose this topic because diet in MS is something, it's no secret. Everybody knows, all the data is out there. But what I'm going to do today in this 1 hour is that I'm going to simplify and organize all the data for you to actually take home some message for your multiple sclerosis, how changes at home, at your own level you can do, so that so much research that is already there can reach to you and translate to actually helping our patients with MS. All of you already might be under treatment with some neurologist, and besides the medications like rituximab or natalizumab, whatever you might be taking, how will diet help you in reducing your relapses or reducing your fatigue or improving your quality of life? That is what this webinar is intended to do for you. Then I'll also throw some light upon supplements, vitamin supplements, like elderly people might be taking calcium, young people might be taking protein supplements. How do all these supplements actually help you, and do they really work, or are they just a pill that you are taking without any help? And then some diets have been formed globally by scientists for MS patients and tried in so many MS patients. And they have studied them rigorously, fixed set of foods, whether they help the patients or not. We will also discuss them a little bit. And after that, I'll be taking some questions and answers from you, which you can now also post in the chat box at any point of time. And after the webinar, we'll do a quick question and answer session. So let's first understand the pathophysiology of MS, which means what is MS in a nutshell? Why do some people get MS and why do some people don't get it? It all starts with genetics, some environmental factors like smoking, sunlight exposure, obesity. And the most important thing over here is the gut microbiome. This is a very old concept, but recently in the last 10 years, it has gotten a lot of importance. What exactly is gut bacteria? So 100 trillion bacteria are there in each of our intestines. And the function of these bacteria is simply to tell our immune system that whatever food is going in, is that what it belongs to our system, or is that an invader? And that helps define our immunity. When these gut bacteria get altered because of any reason, whether due to diet or due to antibiotics or due to any reason they get changed, that increases the risk for autoimmune diseases, asthma, and multiple sclerosis. So gut bacteria should not be messed with, most importantly, and it has been shown that the gut bacteria of MS patients are different from the gut bacteria of normal population. they studied long-term effects of diets on this gut bacteria. People who have been taking vegetarian diets for long and people who have been taking non-vegetarian diets since birth, and they found that the gut bacteria of these populations are different, from fundamentally different. They also studied the gut bacteria after short-term changes. Now, what if I suddenly change my diet and suddenly become vegetarian, and then in how much of time will an effect be seen on my gut microbiome? So surprisingly, that they found within a span of 6 to 10 days there was a change in the gut microbiome. Thus this emphasizes that what you eat really affects your gut microbiome, which affects your MS. Over the years, because of industrialization from 1905 to today 2000, this study is still 2000, but 2023, the incidence and prevalence of MS has grown exponentially. And together with it, we have also seen a rise of obesity. Obesity individually has also been studied, and it has shown that patients with in the age group of 7 to 13 or late teenagers like 18 or 20 years of age, if at that age they had obesity, they had an increased risk of getting MS over their whole life. And diet influences so many things. Like, diet will help you to get a healthy body weight, and a healthy body weight has been shown to decrease the risk for MS related disability and disease activity. Now, what is this disease activity? It was studied as MRI lesions or relapses. So healthy body weight is very important in keeping your MS in control even after you get MS. It is not just important before getting MS, but also after, once you get MS. And that also influences other factors like high blood pressure, high cholesterol, diabetes. All these factors, if they are in imbalance, it might lead to inflammation in your body, which does have an effect on MS. Similarly, I'll be talking something about processed foods as well eventually. One thing I want to, many of you also might have faced many times in your clinic visits, that supplements. What about so many supplements that are available in the market and people keep on talking about, are they good for us? Are they good for us? So vitamin D, yes, we will discuss in detail, but yes, if you ask about vitamin D, you must take vitamin D if you're an MS patient. But as far as alpha lipoic acid, biotin, or our very own haldi, which is curcumin, that is, they are considered. And if a patient comes and asks me, if I take it, will it cause any harm to me? The answer will be not likely. But then at the same time, will it cause any benefit to you? The answer will still be the same, not likely, because we don't really have that much evidence to say that it will benefit you. You take it, you don't take it, doesn't make much of a difference. Then other supplements like vitamin C, E, and then carotenoids and pre and probiotics, the pills that you get for these pre and probiotics, they might have some beneficial effect in improving the inflammatory response in MS. But as far as, and one more thing is alcohol, which we get asked many times, because I'm currently in Australia, and alcohol culture is very common over here. It's not like in India we have it on occasions, but here it is a part of their lifestyle. So a lot of patients have doubts like, can alcohol worsen our MS? Can alcohol improve our MS? So as far as that is concerned, it definitely does not help you in any form. There was some controversy initially that some amount, 40 ml of alcohol, does help prevent heart disease and things like that. But all of that studies have been refuted. And as on today, no amount of alcohol is good for your body, either for any other diseases, neither for MS. Then probiotic and prebiotic foods. These are simple fermented foods that are available initially as something, and then they get fermented to something else. Like we have milk, which eventually gets converted to curd, or we have pickles that we make after salting them, and they're pickles that we have in our Indian culture. So all those foods, they are very, very good for MS as far as the gut microbiome is concerned, because they will change the composition of your intestines. This is encouraged, but only in food sources. For example, as the sources I've mentioned over here, like yogurt or fermented pickles, or prebiotic foods like onions, garlics, and bananas. They would help you in improving your gut microbiome. But with all supplements, it is this chicken and egg problem, that we usually think if a person has low vitamin D, he will have high risk for MS, and then it will lead to worse outcomes in MS patients. But the chicken and egg problem comes is that is that the right thinking, or the real thing is that because of severe MS, the patient is spending less time in the sun and that is leading to low vitamin D? So every supplement that you read about should be taken with a pinch of salt. We have also cautionary lessons from other vitamin supplements in the past. Like they studied folic acid, just observed some people and collected data, and they found that folic acid leads to decrease in colon cancer. But when they studied it systematically in a proper setup, in a randomized control trial fashion, they found that on the contrary, it actually increases the advanced precancerous lesions in the colon. Similarly with beta carotene. So what is actually studied systematically includes only the following. Whatever supplements and data that I'll be sharing now is only based on research and without any controversy. So vitamin D, let's start with the most commonest supplement related to MS, that is vitamin D. So it is found in studies that higher vitamin D levels in MS patients, if you keep it at a higher levels, it will show low MS activity. There are two major trials done for vitamin D. One is the SOLAR trial and the French trial. And the SOLAR trial showed that good levels of vitamin D showed a reduction in new MRI lesions in MS patients, which is a good thing, which is what we are targeting. We want reduction of lesions. And the second was that vitamin D also causes a reduction in relapses, helped in the reduction in relapses. But then a 2023 study just came up, and this showed that it was done in a multiple centers in US over a period of 6 to 7 years, from 2014 to 2019, and then studying it over the next few years. They found that prescribing higher doses of vitamin D for RRMS may not really be beneficial. Means they thought that all the other studies are just showing association, but maybe vitamin D does not really help. Someone else also found that if MS patients were given vitamin D, the rate with which their vitamin D in the body increases is slower than that in healthy people. And vitamin D definitely affects the gut microbiome. That was also found. So what exactly is the truth for vitamin D? As on today, we know that it increases, if it's deficient, it increases the MS risk and leads to worse disease activity. So you definitely must take vitamin D if you are below the normal levels. But results from trials have shown that decrease in MRI activity is also there from vitamin D supplements, although it might not decrease your relapses. And sometimes taking too much vitamin D might also cause side effects like constipation, bone loss, fatigue, and it might increase the fatigue, which is already there because of your MS. So what now is the guideline is that keep your vitamin D between 60 to 100. There should be a 6-monthly monitoring of your vitamin D levels, and 60 to 100 should be your target for entire life. So if it is below 60, you definitely take it. But once you've reached 100, you might be on a maintenance dose. Usual sources are fish, cheeses, mushrooms, and paneer and things like that. Then we come to omega-3 fatty acids. Food sources of omega-3 fatty acids like fish oil, flax seeds, and vegetarian sources like walnuts, avocados, spinach, all them have shown to help MS in some way or the other. But when it comes to supplements, it has shown that when you take it with your drugs like interferons or copaxone, it might actually reduce the effectiveness of these drugs which are given to treat MS. So before taking a pill of omega-3 fatty acids, it's very important to meet your doctor and discuss this. If you take it in food, it will not interfere with these drugs. But if you're taking externally, it might interfere with your MS drugs. And more so if you take more than 3 grams per day, which is not possible if you eat the food, because in foods it is in very less quantity. But if you take a pill, and when you take a overdose of pill, sometimes it might lead to increase in your GI symptoms like constipation, nausea, vomiting, and even increases your bleeding risk. More importantly, if you're a diabetic, it will fluctuate your sugar levels a lot more than what one would want. So as far as omega-3 is concerned, the data suggests that low omega-3 is related with the risk of developing, higher risk of developing MS. And omega-3 is encouraged from diets, from food sources, but advising supplements at this time would not be right. And then we come to salt. Salt, after hypertension, salt has found a lot of attention in MS. So what is exactly the role of salt in MS? Salt does increase the inflammatory activities and worsens disease activity in mouse models. So any research, as some of you might know, first starts in the mind, then starts in the lab, and then it goes on to the patients. So this is the part of the research where they studied mouse models of MS, and they found out that giving them high salt diet does worsen their inflammatory activities. Then when they studied it on patients of MS, they found this was confirmed that high salt intake was related with increase in MS exacerbation as well as MRI activity. But what it was not associated was it can't predict new MRI lesions. Just because you are taking a high salt diet does not mean you will have newer MRI lesions. Similarly, it does not predict brain volume loss. In MS patients, brain volume loss is common over the years, over many, many years. But salt intake does not predict that. So, as far as salt is concerned, lots of studies have shown some relation between high salt intake and relapses, but that is an association. It is not causation. Meaning, they did a benefit trial which showed no relation of salt intake to clinical activity or MS activity. No amount of any amount of salt in the patient's urine, or that which was a way to mark how much of salt they are taking in, did not correlate with their MS disease activity. So further control trials are required. We still don't know the verdict on this, but we can say that salt in moderation would be a good thing. Then role of dairy and dairy products, they are another controversial thing, that high fat milk or cheeses which are processed so many times and so highly processed, paneer and other kinds of dairy products, what is their role in causing inflammation in MS? So that is a bit still again a bit unclear. Different types of dairy products might affect MS differently. So maybe yogurt, because it is also a probiotic, it might be helpful in MS. But at the same time, ice cream and cheese, which is processed food, they might affect MS in a negative way. And not everyone with MS might react in a similar way to dairy. So dairy is a very vast subject, but conclusively in MS, I can say that highly processed dairy substitutes like flavored yogurts and cheeses should be limited, while yogurts, simple homemade yogurts which we make from milk, should be encouraged. Now, after supplements, let's move on to various diets studied in MS. So people have fixed some fixed sets of foods, and they studied it in various MS populations, and then they tried to understand what effects they had on their disease activity as well as other parts of MS like fatigue, depression, their energy levels and things like that. So this diets is what patients often ask us in the clinic, that just tell us what we should eat and we will eat it. We don't want to read so much data about it and everything. So at that point, these 7 trials is what we discuss with them. The first diet that was described was in 1940, and this research is still ongoing in MS. We will just quickly eyeball all of these diets once, and then at the end of it, we can discuss what diet is the best diet. So, and one more thing is that which of the diets have a good evidence for effect in stopping or reversing MS? So till date, none. We don't have any diet which will reverse MS. But the silver lining is that each of these diets have some features which will help in reversing, which will help in a comprehensive care of MS, it will help in other features of MS. Let's go through them. So let's start with the Swank diet, which Professor Roy Swank initially thought of in 1940s, and it was published in 1990 and then again studied once again in 2003. Just because of different changing lifestyles and populations, they decided to study it again in 2003. So what this diet says is that 2 cups of fruits and vegetables every day, whole grains, and mainly they emphasized on low saturated fat diets, that saturated fat should be less than 15 grams per day. You cannot do more than 15 grams per day. Now, what are saturated fats? Saturated fats, Professor Swank thought that they are associated with increasing inflammation in MS, like butter, ghee, all the processed meats like salami and other meats like sausages, bacon, coconut oil, palm oil, all those are very, very highly saturated fats. So our cakes, our biscuits, the pastries, all those fats, basically the processed foods which we get these days, and red meat, they were not allowed in this diet. It was a 34-year-old follow-up study, and it did show that by sticking to this diet with low saturated fat, one reduced the disability in MS, and also there was a lesser likelihood of dying due to MS. You would have died due to other complications, but less likely you would have died due to MS. But the problem is that it had a lot of flaws. This study design is one thing is because in 1940s there was no MRI. So again, the diagnosis of MS was very questionable. They diagnosed MS on the basis of clinical judgment, so that leaves a lot of space for bias. Now we have an MRI and we have evidence to show. So, we have CSF and so many other things to prove that MS is MS. So that was one problem with this study. And also they did not have drugs which we have now, like rituximab or natalizumab or the 17 other therapies that we have. But and they only tried diets and a lot of other random therapies. So that is one thing which was problematic with this study design. And secondly, related to diet, when you cut out the meats and the saturated fats, some amounts of meats also have good amounts of proteins. So reduced protein consumption comes with its own problems, like reduced fatigue, muscle aches and pains, brittle skin, bones, and things like that. So one must be very cautious before attempting to go through a low sat fat diet. Then the next recently, like 1999, if we can call it recent, an Australian physician and himself an MS patient, Professor George Jelinek, he suggested an approach of comprehensive approach, not only diet, but diet, exercise, and vitamin D supplements. And in the diet of whole foods, and he also said that you must also include seafoods. He has written this book called Overcoming Multiple Sclerosis, where he describes this very nicely. And he himself has tried this whole strategy of this diet and exercise and supplements approach. And he found that he was able to stop his progression of MS. This has been studied in randomized control trial as well, and it has shown some benefits as well. Then comes in 2014 the Paleolithic diet. So this was a very interesting physician in US, and she herself was diagnosed with secondary progressive MS in 2007. And she states that by using her own diet, that is which she has now called the Wahls protocol diet, she reversed her MS, and from a wheelchair she is currently walking. She uses she's a cyclist. She pursues hobbies, and so so then she talked about this diet, and then she has studied it in clinical trials also. So the paleo diet is a diet mimicking the people from the Paleolithic era, like the cavemen. So how our ancestors used to eat no processed foods. She eliminated all processed foods and all dairy as well. Modifying this Paleolithic, following this Paleolithic diet along with exercise, it showed that it will improve fatigue a lot, elimination of processed foods and dairy, and it will improve quality of life, mood, and motor function as well. So it is very helpful in patient who would have EDSS score of more than 5 or 6, because if their motor function would improve, it would prevent them from becoming bedbound. But the caution in this diet is it could have led to deficiencies in folic acid, thiamine, and B6, which is available from not processed foods, from dairy or other animal sources. Then we had in 2016 McDougall diet. This McDougall diet is a different strategy, that low fat, high carbohydrate, moderate sodium, but again no dairy. It was again vegan diet, and they eliminated no animal derived foods as well, like no dairy, no eggs, no meat, no fish as well. Whereas one of the previous diets focused on fish and seafood, McDougall diet eliminated fish as well. And in the results, we found better weight loss, reduced cholesterol, and also reduction of fatigue. So these two diets were very well showing results for reduction in fatigue. Fatigue is a major problem, so they showed good results. But caution with this diet was, again, it led to deficiencies in iron, B12, and vitamin D, calcium, and other supplements. Then came the modified Mediterranean diet. Mediterranean diet is a really, really old diet, and it is a very simple diet in the form of, it includes this pyramid. It's very simple to understand that lots of green leafy vegetables and fruits, fish, and you can even eat dairy, but everything in moderation. They even recommend red wine in moderation and lots of hydration water. And less often, occasionally, you might have meats and sugary sweets. So this modified Mediterranean diet also showed some benefit in fatigue levels. And then gluten-free diet was also studied, but not much benefit was found. So all these diets, which I just ran through, we explained to all our MS patients whenever someone new is diagnosed with MS. Me and my MS nurse, we sit down with them, and in an hour-long session, we discuss all these diets and what lifestyle changes have shown effect in MS patients. So, no salt and low salt, no processed food, lots of vegetables and things like that. We were recently explaining to a patient, and so he told me that, doctor, you mean that if it tastes good, just spit it out, right? And I had no answer to that question. Well, so then one American scientist, Michael Pollan, he suggested that what is most common in all these MS diets, it's just that eat food, not too much, and mostly plants. So important line in this was not too much. Calorie restriction. That is where the latest and the most significant diet comes up, that is intermittent fasting. So does the amount of calories you eat matter? So initially in the lab, they started studying in mice who had MS. They induced MS in some mice, and they tried to restrict their calorie intake, and they saw that their inflammation in the brain had significantly reduced. And also, before inducing MS in them, before giving them the disease MS, these mouse were asked to try intermittent fasting, means their calories were restricted, and they'd realized that there was lesser risk of MS in those mouses who had tried calorie restriction. One more thing which was interesting was that MS is a demyelinating disease. That is, all our nerves are covered with myelin, coating called myelin, and MS disturbs that myelin coating. But calorie restriction has some potential, which has been found in some studies, that it might cause this myelin to be repaired. So caloric restriction or intermittent fasting, which means not eating for 16 hours a day, just eating for 8 hours out of the 24 hours, might lead to reduction in inflammation and perhaps even repair in the lab. Now people have gone on to try it in general population for weight loss, obese population, but trials regarding intermittent fasting in MS patients are ongoing, and within the next 1 year or 2 year, we might get the results for it, which are looking very hopeful. So ultimately, what is on your plate? What do you think should be your ideal plate? So I will anyway be sharing this presentation with all of you, but this is a very important thing which you can maybe keep on your phone or when you have a meal, that it should have fruits and vegetables. Half of your every meal should have fruits and vegetables and whole grains, as well as proteins. Protein sources, that is up to you to decide whether it is you want to include animal proteins or plant proteins. But besides that, choose foods and beverages with less added sugars and less saturated fat and sodium. And also, at the same time, with every dietary advice, there comes the advice for exercise. So an active lifestyle always helps. Future directions in MS mainly are that various diets have been proposed for MS, but evidence for a clear benefit for any of them is lacking. And rigorous studies that include measures of adherence, that is for patients to stick to their diet, to have reduction or at least some respite in their disease activity and quality of life are required. And there are serious challenges to conducting dietary research in MS, which is very difficult to ask the patients to eat something specifically, because after all, a person will eat only what he wants to, no matter what. So this is a very challenging thing to even research, but scientists are really working hard in this area. So let's hope for something. In any case, experts do agree on these 4 points, that prepare your meals at home as much as possible and incorporate colorful fresh fruits and vegetables daily, as I showed in the ideal plate, that half of your plate should be fresh fruits and vegetables whenever you eat. So try to do that. And if you choose to eat grains, choose whole grains over refined grains. This is another important point, that whole grains are always better than processed and refined grains, and avoid or limit processed foods or added sugars as much as possible. So yeah, maybe if it tastes good, try to limit it, if not spit it out. So thank you